for joining the 6th Lillian Meighen Wright Maternal-Child Health Learning Academy. For those of you who've been part of our previous institutes, you know that this is the first time we're holding this virtually. Usually it's in person. And so that's new as well, that because it's virtual, we kind of divided the day up. So there's 2 days, today and Friday. The focus this year is maternal child health and well-being in a global pandemic, a very current issue, a situation we're all living in. And with specific attention to promotion, prevention, and intervention. My name is Nazila Kanlu, and I'm the academic lead of the program. I'm also an associate professor at the School of Nursing, and I hold the chair in women's mental health at York University.
Everybody, welcome to the 6th Lillian Meighen Wright Maternal-Child Health Learning Academy. For those of you who may not know, the Lillian Meighen Wright Foundation Maternal Child Health Scholars Program was established in 2008.
New grant initiatives. So, when we're thinking about the topic today, I think I'm much more in the prevention and promotion aspect of the pandemic and how equity plays into that. And for us as researchers, things that we need to think about. I feel like there's a bit of a delay. So we're a health research training program, which is a new initiative of the Canadian Institutes of Health Research. Divert Mental Health is one of it is the inaugural cohort. So there are 12 of us across the country who are funded. And so this one is housed at York University, but we also have principal investigators from coast to coast, as I'll talk about.
Yes, I'm an associate professor in the teaching stream, and that's going to color some of what I talk about today, because I will be talking about teaching as well. The Department of Equity Studies is my academic, focusing more on intervention. And I just like Professor Kanlu, I was thinking of the last slide in the previous presentation, and the point about the legacy of the pandemic being, hugely informing for the work that we do in the next, 5-10 years. And a lot of what I'll be talking about is from an academic planning and service perspective, and that has relevance too. I just stepped down as chair of the academic policy as well, and how that will affect student mental health, has affected and will continue to affect. So I appreciate that reminder as well. All right. So yeah, the paper that I submitted to the journal focused on mothering in the remote academy, and I was exploring concepts of building bridges and negotiating isolation, which were features of the pandemic for many of us. So 2 caveats to off the top.
Is Denova Kiruba, and I'm leading a community-based study on gender-based violence as it took place specifically in the Canadian South Asian community during the pandemic. And this is being run by an umbrella organization who's the Council of Agencies Serving South Asians.
Learned a lot from each of the presentations, and I like the format. So it's an incredible thing to have a community voice as well as the academic voice. And I think what Rebecca is leading this national
Council of Agencies Serving South Asians. So similar to Denova's program, I am working on a gender-based violence project as well that actually just started. So we're still very much in the very beginning phases of the project. I will quickly go over it. And this project is understanding toxic masculinity and its impact on gender-based violence and intimate partner violence in South Asian communities. I know we were talking about masculinity.
Yes, I am a professor PhD at the Ana Neves School of Nursing at the Federal University of Janeiro. Professor strict sense post-graduation program in leader of the research group on sexual and the significant increase in maternal death relates to the COVID-19 pandemic. This event,
who is a faculty professor and vice coordinator of the undergraduate nursing course at the Federal University of Paraíba, Brazil.
The title of our abstract is Maternal-Child of Life and Caretaking of Children during COVID-19 pandemic. I am Jacqueline Macedo. So the confinement caused by COVID-19 pandemic has disrupted the routine and way of.
Everyone, my name is Sarah Fadani, and I'm a research assistant at York University under the supervision of Dr. Shaira Brandy, and I'm a PhD student at McMaster University in Health Research and Biology. Today we will be talking about COVID-19 vaccine intention and related anxiety and obsession in postpartum women.
My name is Chang Su, an assistant professor in Department of Psychology, Faculty of Health at Brandon University. Today, I will present my poster, which is the impact of COVID-19 on the parental stress and the coping strategies of parents of children with developmental disabilities of Canada.
Incident of violence is one of the most common types of violence in the world. The World Health Organization defines intimate partner violence as actions that go to
Psychologist at Mother's Craft Breaking the Silence program in Toronto, and adjunct faculty in the Department of Psychology at York University. Also, she has a degree in clinical developmental psychology at York University. And I'm really grateful, Dr. Motz, that you joined us, because one of the things that we do through the Learning Academy, but through also other events we organize through our office, is making sure that we have a community perspective.
Brief overview of our program and the families we serve. And then I will talk about the global impact, the impact of the global pandemic, specifically how we needed to make changes to the program, as well as the impact of the pandemic for our families, including risk factors and factors that supported resilience.
Hello, bonjour, Sego. First and foremost, I acknowledge the land from which I present to you today, that of here, but also I have some additional considerations of inequalities of mothering in academia, its existence pre-pandemic, and the general undervaluing of childcare. So just to tell you a little bit about myself before I move on, I do specialize in early childhood education. I focus particularly on informal learning context. So the importance of
at the intersection, talking about parental partnerships, homeschool relations, talking about critical race theory, and all of it. It's exciting, it's wonderful. So let me begin by saying that it has been widely accepted globally that the COVID-19 pandemic has exacerbated and highlighted really inequities in both systems of education and systems of health.
I'm a PhD candidate with the University of Alberta, and currently an assistant professor at Meighen University here in Edmonton, Alberta. So I'm going to be talking about mothering, academia, and the COVID-19 pandemic. So before I begin, talking about how we came to the idea really to put something on paper about our experiences. So really noticing the problem. I'm going to talk a little bit about the personal narratives that we've done and what those common themes were, discussion. Thank you.
Hello, my name is Ana Beatriz Roy. I am a professor at the reproductive training in Brazil during the COVID-19 pandemic. Background. During the health crisis, pandemic on the health of women with breast cancer in Brazil.
My name is Larissa Faria. I'm 23 years old.
I'm a student of the Federal University of Rio de Janeiro, Honorary Nursing School, now in the sixth.
And I'm a postdoctoral fellow at Center for Addiction and Mental Health. So my topic for the presentation today is on youth perceptions of mental health and parental relations, findings from sample of Pakistani Canadian immigrant youth living in metropolitan cities.
Thank you for taking the time to join my abstract poster presentation. My name is Ms. Sayla Sen. I'm a Master's of Nursing student at York University. The topic of my presentation is the role of parents in mitigating children and adolescents' experiences of health-related during the COVID-19 pandemic.
At patient engagement, which I found it really difficult during COVID-19 with all the lockdown rules and all the safety protocols from public health that we had to follow. And McGuire, a fourth-year undergraduate student in the Specialized Honors Program in Psychology at York University. This project is part of my undergraduate thesis, supervised by Dr. Meighen. The aim of the project was to take a qualitative approach to understanding how the shift to virtual services during the pandemic impacted social support for refugee mothers.